Assalamu alaikum. During clinical consultation day. First scenario, you are the doctor in the medical assessment unit. Mr. David, 30 years old, has lower limb weakness. Please take history, examine the patient, and address his concern. Ready, Dr. Sarah?
Yes, doctor.
Okay, here you go.
Okay. Hello?
Yeah.
Hello?
Hello?
I'm Dr. Adel Karim. I'm one of the doctor covering the medical assessment unit today. May I confirm that you are Mr. David, 30 years old?
Yes, doctor. Yes,
Mr.
doctor.
David, we are here to talk regarding your health condition. After that, I want to examine you and we can address your concern. Is that okay with you?
Okay, doctor.
Yes. Could you please tell me regarding what brought you here today?
Yes, doctor. I have problem in my leg. I cannot walk uh, since like today morning. I have that weakness like 2 days ago. Then it increased, and today I cannot walk at all.
I'm sorry for that. So this is the first time to happen for you? Before today?
Yes, doctor. Yeah.
Okay. Is it started for you like sudden or gradual?
It's like gradually, doctor, and it's increasing.
Mm-hmm. Which side is affected? In one leg or both leg?
Both legs, doctor.
Mm-hmm. Okay. Where it started exactly? In the lower of your leg or in the upper?
Firstly, I started to feel my legs are weak, but
Mm-hmm.
I cannot judge exactly where. Then it was increasing. Then today I cannot walk at all.
Yeah, you feel all of your leg.
Yeah,
Okay.
I
Is it
cannot walk
like
at all.
floppy or stiffy?
It's not stiff, doctor.
Mm-hmm. Until now, you have this weakness or it recovers or any improve?
No, it's worsening.
It's worsening now. Mm-hmm.
Ah,
Okay. Is it look like come in ascending manner? I mean, it started from your yes lower leg and go up.
I cannot judge, doctor. I felt the weakness. Then today I cannot walk at all.
Mm-hmm. Okay. Anything worsening it when you are
No,
take heavy carbohydrate meals, vigorous exercise before this weakness?
no, doctor. No,
Any stress?
no,
Okay. So apart from this weakness, do you have any weakness in another part in your body, like weakness in your face?
no,
Mm-hmm. Do you have any other sensation along with this weakness?
no,
Okay. Any loss of control of your back passage or waterworks?
no, doctor. No,
Any back pain?
no,
Any trauma to your back?
no.
Before this weakness, have you ever been recently unwell?
No, but like I had this diarrhea
Mm-hmm.
like 10
Okay.
days ago.
When this loose motion started for you?
Uh, it's like 10 days ago.
Okay. So did you seek medical advice for that?
No, doctor, I took some medicine for the spasm, then
Mm-hmm.
sorry for the tummy pain, then it's improved after this.
Okay.
From
Okay.
medicine.
So do you have any fits?
No,
Any loss of consciousness before?
no,
Any headache?
no,
Any vision problem?
no,
Any hearing problem?
no,
Any speech problem?
no,
Okay, well, okay. So regarding, do you have any high body temperature now?
no, doctor,
Okay. Do you have any weight change?
no,
Any lump or bump in your body?
no,
Mm-hmm. Any tiredness?
no, doctor, but I cannot move. I cannot walk.
Okay. So anyone comment for you or become better than usual?
No,
Okay. So do you have any difficulty of swallowing?
No,
Any change your bowel habit?
no, doctor.
Any
Only
difficulty
just
in breathing?
10 days ago, then
Mm-hmm.
nothing now.
Any difficulty in breathing? Hello?
Yes, doctor, I have some difficulty of breathing.
Okay, when started for you?
Hello?
Hello? Yes, yes. When started for
Yes,
you?
my voice is clear?
Just there is delay, some delay in your voice. Okay,
It's
when
okay
started
now?
for you?
Or... Yeah, it started yesterday. I felt like
Mm-hmm.
more difficulty in breathing since yesterday.
Mm-hmm. Okay, so this shortness of breath, it awoke you from sleep, searching for air.
No,
Okay, this shortness of breath online flat.
no,
Do you have any cough?
no,
Any coughing up blood?
no,
Any noisy chest?
no, doctor, no,
Any swelling in your leg?
no,
Okay, do you have any medical background I should be aware of?
nothing, doctor. I don't have any problem before.
Any previous surgical history or any procedure?
No, no, doctor.
Okay, do you have any change in your water work regarding the amount, color, frequency, any burning in your water work?
No, doctor, but I didn't pass urine. I did pass water work since
Mm-hmm.
yesterday.
Mm-hmm. Okay, I'm sorry for that. I will try to help you regarding this.
Yeah,
Okay, so do you have any joint pain?
no,
Any skin rash now or before?
no, doctor.
Okay, so any difficulty in comb your hair?
No,
Okay, so could you show me your medication list, please?
I'm not on regular medications, doctor.
Any over-counter medications?
No,
Are you using any recreational medicine? I'm sorry for asking this
no,
question.
doctor. No,
Okay, so I'm sorry for asking this question. Any piercing?
no,
Any tattooing?
no,
Sharing needles?
no, doctor. No,
Any casual relationship?
no,
Do you have any family history of thyroid condition?
no, I'm not aware of
Any
this.
any family history of not?
No,
What you are doing for living?
I'm accountant.
Mm-hmm. Okay. How much your condition impact your job and usual daily activity?
Yeah, I didn't go to the work yesterday and day before yesterday also.
Mm-hmm.
Because I couldn't manage. Then this problem worsened also today.
I'm sorry for that. We can give you sick leave, and even we can provide you the report for your job, and even we can involve the occupational health workers if your condition needs that. Is that okay?
No, yes, doctor. Okay.
So do you drive?
Yes,
Okay, so yes, advise you to stop driving until you sort your problem. Is that okay?
yes, doctor. I couldn't manage to drive even.
Yeah, okay. So do you smoke?
Yes,
Mm-hmm. How many cigarettes and for how long?
I smoked like 5 to 6 cigarettes for 10 years now.
Mm-hmm. Advise you, yes, we advise you, Mr. David, to stop smoking because the smoking is hard for your health. Is that okay with you?
Okay, doctor.
Okay, do you drink alcohol?
No,
Okay, before this, did you eat any canned food before?
no,
Any travel history before?
no.
May I examine you now?
Okay.
So you need the, yes, the general look of the patients and the vital chart,
The
including.
patient, there is no obvious
Mm-hmm.
characters. Okay.
Okay.
The vitals, blood pressure 110/70,
Mm-hmm.
the heart rate 80, temperature 36.8.
Mm-hmm.
Okay.
Okay,
Okay.
oxygen saturation.
Saturation 96.
Mm-hmm. I would like to do force vital capacity for these patients beside. Okay.
Okay. Okay.
So I
Minute.
will start. Yeah. I will start to examine the lower limb neurologically.
Yes. What you want to check?
Yes, regarding the tone, power, reflexes.
Okay. There is hypotonia.
Mm-hmm.
Okay. There is bilateral lower limb weakness, and
Mm-hmm.
there is hyporeflexia
Okay.
and mute plantar reflex.
Okay. Okay. Regarding the weakness, flaccid weakness. Okay. So the coordinations. Uh, my patient able to do it.
No, cannot.
Mm-hmm. Okay. Yes. Also, I will check the facial muscles
Okay.
for the facial nerve if it affected. Could you please
No.
clench your teeth for me? Blowing.
Okay. Normal.
Okay. I'm going to auscultate the chest. If there is any added sound, any crepitation in the chest.
Nothing.
Mm-hmm.
Normal auscultation.
Okay. And also, Mr. David, are you able to swallow for me? Or you have
Yes.
any difficulty now?
No.
Okay. Okay. So, also, I would like to examine the abdomen if there is any tenderness or any
There is
masses,
no tenderness.
any sign of
Masses where?
dehydration, dry skin, a dry mouth, capillary failure.
No. It's okay. Blood pressure is okay. No
Okay.
dehydration.
Okay. Well, okay. Yes. So, may I know what is your concern?
Yes, doctor. What I have exactly?
Yes, Mr. David. Actually, after I'm ask you some question after examining you. Uh, I'm sorry for that. You have been troubled with this weakness, most likely due to conditions which called Guillain-Barré syndrome, in which there is a disturbance in defense system. Instead of attack the bug in your body, it attack your nerve, supplying your muscles in your body. That is why you have this weakness. And your conditions, this it is usually triggered by certain infection. Your conditions, it's likely to related to your loose motion that you are having before this weakness. What we are going to do now, we are going to be admitted, and we are going to run for you some blood tests and some scanning to confirm our diagnosis. We need also, because of this condition, it can affect the breathing muscles. Now you have been troubled with this shortness of breath. We need to follow your breathing by some special test, which you call blowing test. And also, we need to follow your
2 minutes
feeding and
left.
swallowing. Okay. We need to make a group of specialists in which include the nerve doctor and the nerve doctor and the physiotherapist, occupational therapist, okay, social worker, specialized nurse to help you and to provide you with suitable plan of care. So do you have another concern for me?
Yes, doctor. So is it curable condition, or I will be dependent on wheelchair?
Yeah, your concern is valid regarding the treatment. There is actually two options of treatment. One of them, yes, we need to give you some healthy protein that will reduce this harmful protein in your body, and also there is also some like it might connect you with machines to filter your blood from these harm proteins and to help to recover your conditions. Regarding this, we need to, yes, make a group of specialists, as I mentioned to you. Regarding your recovery, this condition has good outcome. Just it might need to take a time like a month. Do you have another concern for me?
No, doctor. Thank you.
So we advise you to stop driving. We need to involve the DVLA to inform it. Okay.
Okay, doctor. I don't drive, doctor. I couldn't drive even.
Yes, yes. That is
Mm,
why after you become better, we need to assessment again before you come back to driving.
okay, doctor.
Okay. So
Okay, time is up. Questions? Dr. Ala, please.
Okay, can you present your case?
yes, Mr. David, 30 years old, presented complaint with lower limb weakness. It started since 2 days. Just since morning, it become more worse, preceded by the diarrhea. This weakness, like floppy flaccid weakness, most likely, most likely, um, most likely as diagnosed with the Guillain-Barré syndrome.
So
And now I
what
believe
was
this
in
patient
your
complicated with shortness of breath now. What?
examination findings?
Yes, on examination of these patients, he has he has sign of lower motor neuron lesion in the form in examination of the lower limb. He has sign of lower motor neuron lesion in the form of hypotonia, and hyperreflexia, mute plantar, and weakness. Affect all of his leg, both leg. Most likely, this patient he has Guillain-Barré syndrome or flaccid weakness for differential.
Yeah, he has sensory level.
No, sensation not affected.
Did you check?
Yes, I'm sure.
Mm, let's check. Okay,
Mm.
what's other differential?
Okay, other differential for these patients, I will put botulism. I will put myasthenia gravis. Also, I will put periodic paralysis. But again, is that not recurrence? Okay.
Okay,
Acute
any other?
intermittent porphyria also.
Okay, okay, another differential.
Okay, I'm very. Yes, acute intermittent porphyria, myasthenia gravis, botulism, um, periodic paralysis. Also, in these patients, we need to exclude the transverse myelitis in spinal shock stage.
So, how do you investigate?
Yes, regarding investigation for this patient, first general workup in the form of full blood count, and inflammatory markers, and also renal function test with electrolytes and liver function test. I will do specific investigations like nerve conduction study, EMG. Okay. Also, I will do lumbar puncture to look for alpine cytological dissociation. Okay, and I will do force vital capacity as I mentioned up. Um, if this patient is still having loose motion, we can test stool general analysis.
Okay, so what's your management?
The management patient should be admitted. Okay. Um, ABC monitoring of breathing. Yes. Okay, regarding the specific therapy regarding this Guillain-Barré, we can give him intravenous immunoglobulin, and also there's another option, plasmapheresis or plasma exchange, and also non-pharmacological MDT. Okay, physiotherapist, occupational therapist,
Okay,
rehabilitation program also.
You're done, Dr. Ala?
yes, okay.
Okay, I will ask here still 40 seconds. Do you think is it curable, Dr. Sarah, this condition?
Regarding these conditions, just it can be controllable, not curable.
So if the patient recovered, do you think there is
Sorry, قصدي curable, not control. Yes, curable. Yeah,
okay, if
curable.
the patient recovered, do you think
Mm.
any possibility
There is another
of recurrence?
risk of relapse. Yes, yes.
Okay. And you mentioned the
Mm.
plasmapheresis.
Mm.
Uh,
Yes.
what else? The mode of treatment
Intravenous immunoglobulin, plasmapheresis.
and any role for the monoclonal biological therapy?
I didn't sure regarding this.
Rituximab has a role.
Actually, I didn't have any idea
Okay.
regarding this.
Okay.
Yeah.
Well done. The good thing, and you are lucky, you just practiced yesterday lower motor neuron muscle disease. That's why you're still fresh. And Dr. Ala give you
Yes.
the best topic on time. Okay.
Yes.
Yeah,
Dr.
Exactly.
Ala,
no,
your
she
comment now,
did it.
please.
No, she did it very well, and she also tried to exclude the other differential hypothalamic periodic paralysis. She asked about the high carbohydrate meal, the exercise, the botulism. Also, she asked about it. She asked about the trauma, which is good thing. The she also tried to exclude the sinister things. Okay. Uh, Play small things, the differential diagnosis. Okay, this patient came with acute bilateral lower limb, lower motor neuron weakness. Okay, so and he has no any sensory affection. Okay, so I think the botulism and myasthenia uh, will not appropriate here. Uh, Also, the transverse myelitis it will have sensory affection. The uh, the most probable the differential here we can put the Guillain-Barré syndrome. This is the first line. Hypokalemic periodic paralysis that you put. We can also think of thyrotoxic periodic paralysis. Okay, you did ask about any thyroid symptoms. The other thing, anterior cord lesion. Okay, anterior spinal cord artery thrombosis. You can also ask about any history of blood clot or family history of blood clot, any history of thrombophilia. This during the shock stage. This will cause upper motor neuron lower limb quickness, but maybe also in the shock stage can be lower motor neuron. Uh, in the examination only this sensory level, you didn't check the sensory level. In
I
chest examination, you
imagine.
can,
Yes. As I check.
yeah, you asked
Mm.
about the power, the tone, then the power, then the coordination and reflexes.
Perception
You didn't ask
sensation.
about the sensation. Yeah, it's
Yes.
important.
Of
The
course.
chest. Yeah, you can check for chest expansion. Okay, you can also do upper limb examination. Upper limb check also for weakness in the upper limb. Uh,
Mhm.
okay. I
Okay.
think that's it. The investigations are okay. The Also the management also it's okay. Well done.
Thank you.
Yes, well done, Dr. Sarah. I agree with Dr. Ala, but one mistake, it might be fatal if you said or if you invent finding. Take care of this. Better to say
Yes,
I
yes.
I couldn't or I didn't examine, rather than saying suppose or there is no there is no
Mhm.
sensation or there is a loss of sensation or whatever the sensation. So say I couldn't or I forget to examine. But if you
Yes, I
mention
guess I'm
something,
not sure. Yeah, I imagine.
yeah, yeah, I know,
I
but
think yes, because
don't, yeah, don't
mm,
assume it will be there because of the scientific issue or
yes, yes, you're
yeah.
right.
Okay, yeah, there is some sensation affection, or sometimes it will not be affected, but don't
Mm,
assume it because of the scientific point of view. I will say this is the patient is having. Anyway, in general, as a performance, really you did perfect from the start, the onset course duration, the analysis of the relevant system. But please add to your question whenever you have weakness to differentiate either to go with the upper or lower motor neuron, the type of weakness. Is it floppy one or stiffness one? Why?
Yes, I'm asking regarding this.
You
Yeah.
asked? Okay,
Yes.
if you
Yes.
asked me. Okay, good. Good question. But also for reminding others,
Yeah.
whenever you have weakness, please ask the patient from the start what type of weakness you are or experienced. Why? Because you might go with the upper motor neuron lesion or lower motor according to his answer and the differential, of course. So in this scenario, yeah, it's clear that it was preceded by infection. So you will try to ask this question, stress on this question, and he will give you the history of infection, recent infection, GI, or he will tell you it was previously happened with me and it was after glucose full diet, and it will be related to periodic hypokalemic paralysis or hypokalemic periodic paralysis. Anyway, sometimes also with the thyrotoxic. Okay, so it's not only that. So you can put the three differential as Guillain-Barré, thyrotoxic periodic paralysis, or hypokalemic periodic paralysis. All of them can be matching. I added also in the chat box chronic inflammatory polyneuropathy, demyelinating polyneuropathy, as a differential or the chronic form of Guillain-Barré syndrome. At the same manifestation, autoimmune, and the same attacking of the nerves.
Just
The
because this is
yeah,
acute. Yeah.
exactly. You can say it, but you can say again is that this is of acute onset. But if the
Mm.
patient will come back or he has relapsed and improving, we might think about other differential, which is called CIDP. It's very important to just pay attention to the examiner that it would be as a chronic form. The multifocal, I think also multifocal motor neuropathy, one of the differential, because this is weakness, particularly the motor power defect. So I think also can be as a differential for the motor neuropathy. Maybe as Dr. Ala mentioned, the anterior cell or arterial core syndrome as acute onset also. It will happen with only weakness, with no sensory affection, as in this scenario. But I think also in the anterior core syndrome, the weakness will be upper motor type, Dr. Ala,
Yes,
isn't it?
Victor.
Yeah,
Dr.
yeah, it
Ala.
will be upper motor neuron, but I mean
In
the
shock
shock stage.
stage. Yes, in the
Yeah,
Financial
yeah,
shock
it will be
stage.
stage.
lower motor.
Yes, you're right. Okay. The other system review you ask clear and also in the order which I like from up to the toes down. The skin rash, you ask everything about the constitutional as well. The contact or the food intake also, it was one of the good question. Travel, family history, all this, I think you cover and you did it well. The most important thing here to roll out the criteria of ICU admission, and you give it by one answer, ABCD approach. So I will ask you, Dr. Sarah, what is the value of forced volume capacity you will admit the patient to ICU?
Yes, I think less than 1.5.
No, this is
Forced
not
vital capacity, I mean, less than 1.5.
what the unit you mean.
I didn't remember exactly, actually.
Okay, 20 ml per kg.
20 years. Yeah. So
Okay, less
this.
than 20 ml per kg.
Okay,
The
okay.
patient should be admitted to the critical
Mm-hmm.
unit for observation and monitoring his breathing. Particularly, he has some weakness and short of breath. Okay. What are the or what is the most common organism responsible for this infection?
Campylobacter
Yes,
infection.
yes, Campylobacter jejuni. 15, Dr. Ila, 15 to 20 ml, yes, but less than 20, you should admit the patient to critical unit or ICU
Mm-hmm.
for close observation. You can do
Okay.
the
Yes.
spirometry as you said in the test or the investigation, just to monitor and to check for the value.
Mm.
Pulse oximetry you can add as bedside tests, ABG as well. What do you think the importance of ABG in this scenario?
Yes, regarding the respiratory clauses.
Is it
No, and
alkalosis or
respiratory, no,
acidosis?
respiratory failure also.
Yeah, what type of
Acidosis.
respiratory failure you might have in this scenario?
Type 1.
Do you think it's type 1? What the nature of the short of breath in this scenario?
Weakness of the muscle.
So- Yeah, so the muscle, it will lead to what? The weakness.
Type 2.
Yes, CO2 CO2 retention,
Yeah.
ventilation, right? The
Mm.
ventilation will be impaired and the CO2 will be raised. And it will
Mm.
lead to respiratory acidosis.
Mhm, mhm,
He might need BiPAP or non-invasive ventilation or even intubation in case of severe respiratory acidosis.
mhm.
That's why you have to start your approach by ABCD approach. This patient
Yes.
should be monitored, his pulse oximeter, his respiratory acidosis, CO2 level, all this indication for possible intubation and
Mhm,
airway protection from the start. If the patient is having short of breath or respiratory symptoms, should be admit to the ICU whenever his forced vital capacity is less than 20 ml per kg.
mhm.
Okay. What's the nature of the weakness in this patient?
Floppy.
Lobby and the manner of weakness
Ascending weakness.
ascending and in which part particularly would be affected more? Is it distal or proximal?
Distal and going up.
Exactly, yes. Okay, thank you, Dr. Sarah. Any question?
No, thank you.
Okay. Any question from Dr. Ala or added point? Any suggestion?
No, thank you. Thank you, Thomas.
Yeah, good case, Dr. Ala. Thank you. Any question from other? Prepare yourself, Dr. Ala, for the next scenario. We'll start after discussion. Anyone with question or discussion? Any point to be raised? Any suggestion? Okay, motor neuron disease, Dr. Musa, Dr. Mahmoud, I think he put it in the differential. I agree, but not in young patients. Yeah, there is only motor affection, but I think the motor neuron, you can put only the type with lower motor neuron lesion because we have the mixed type. If Dr. Rabia, she can also give us good differential.
No. The Dr. Sarah was very good and the differentials were very good. This is acute flaccid paralysis, okay? So acute flaccid paralysis, number top is GBS. Second, periodic paralysis, whether hypo, hyperthyro, whatever. And the third will be botulism. You can put tics paralysis also, but this is not in our state or in our countries. And after that, myasthenia gravis is one of the differentials, okay? This is for acute flaccid paralysis, okay? But if you are thinking of motor neuropathy, then you have to keep GBS plus intermittent porphyria plus lead neuropathy. These are
Mhm,
another set of differentials. Motor neuron disease you cannot put because motor neuron disease, it is not acute flaccid paralysis. It's like a gradual progression, and there are a lot of other features. Okay, so motor neuron disease will never come in acute flaccid paralysis. Okay, it can present with only lower motor neuron like
Yeah,
spinal muscle atrophy, but it will not present as acute flaccid paralysis.
yeah, it would be for the CIDP,
Yes. But
for the
CIDP also, Dr.
chronic.
Vasan, CIDP has
because
to have relapse and remitting course, okay? This is, unless you have a previous history, you cannot label CIDP.
Okay.
mhm, exactly.
Oh, thank you, Dr. Rabia. Well done. Thank
You're
you.
welcome. You're
Thank
welcome.
you also, Dr. Sarah. Any other question? Dr. Huda, yes, type 2 acidosis, exactly. Ascending 1, CO2 retention, exactly 20. Okay, so clear this topic, GBS. It's common case. And I think it came also
Today.
in Egypt as neurological patient. They present patient with the lower motor neuron lesion and they needed only to hear the Guillain-Barré or Guillain-Barré to give the full mark. I think otherwise they minus all doctors. Right, Dr. Mahmoud? It was in your diet?
No, Doctor Galambari, my side. My case was different and difficult. You know, Dr. Basim, when I feel the sensation in the lower limb, the sensation is increased more than in the chest.
Paresthesia, you mean?
Paresthesia, yes.
Mhm.
And
But-
it was upper only that in the case. It was upgoing plantar and paresthesia, only that. But the examiner was Dr. Ahmed. So he gave me the full mark. Really gave me the full mark. I told I told him everything in euro. Trauma, tumor, MS.
Yes.
So he go on with me. What is the treatment of MS and what is the investigation? And he gave me the full mark.
Okay, this also was correct answer.
But I don't know paresthesia in euro. I don't know the cause really.
Okay, Dr. Rabi would ask, she can help in this part, but I think multiple sclerosis is one of them.
عندي مشكله
Yeah.
انا لازم التجربه دي تكون واضح.
Okay, Dr. Rabia.
Dr. Asim, I could not hear very
Paresthesia.
clearly. But
Yeah,
Dr.
he's
Musa was
asking
saying-
what the possible cause of paresthesia in paces. I told him MS, one of the causes. What
Yes,
other
it
cause?
could be another
I think
presentation.
also radiculopathy, right?
Yes, radiculopathy, MS, even GBS can only present with paresthesias, okay? If the
Mhm.
patient has sudden onset paresthesia, you should rule out GBS, okay? Because initial presentation could only be sensory symptoms, okay? It depends upon the course. Is it acute, subacute, or chronic? So if it's acute paresthesias, but usually MS will not give you bilateral. MS will usually give you asymmetrical, you know? So less likely only paresthesia. It's a very a broad term paresthesia. So usually
Yes,
MS
sorry,
is more
Dr. Rabia.
technique.
Sorry, but this is a sensory level up to the clavicle. The sensation increased
Sorry,
up.
Dr. Musa, I cannot hear you. Yes. What?
Yes, the sensation paresthesia up to the clavicle. It was sensory level.
To the clavicle paresthesias.
Yes, it is not
Less likely to be. And you can. I mean, if it's clavicle, so it has to be cord, above the cord.
yes,
It
yes,
has to be somewhere cervical cord MS.
and
Transverse myelitis can be a reason.
Yes. Myelitis. And myelitis could be due to demyelination, could be due to tumor, trauma, disc, anything.
Yes, exactly. The same time, Dr. Rehab, she wrote the same. What about transverse myelitis? Perfect. Okay, so clear now. Thank you, Dr. Mahmoud. Thank you, Dr. Rabia. But I heard also about GBS in the same diet and same center, but maybe in another day. And the case was Guillain-Barré. So it was lower motor neuron weakness and without sensation affection, and there was a reflexia all over or down in the knee and the ankle. That's why it was. I think they hear the Guillain-Barré and they give full mark for the candidate who gave the differential of Guillain-Barré. Anyway, if you have it as a short case, you have to say, I would like to take history. Why? Because the history will help me to differentiate between either acute or chronic. And I will go through the acute causes according to the onset or the chronic causes according again to the duration. And there is causes for the acute and there is causes as well for the chronic. Okay, we mentioned most of them today. Any question before moving to the next scenario? Ready, Dr. Ala? Yes, Dr.
Yes,
Rehab.
Dr. Basim.
Yes,
Yeah.
I'm ready.
Okay. Doctor, sorry, I will answer this question before moving. We mentioned yesterday case of lower limb examination. What's the difference? What the difference between what, Dr. Rehab?
I'm asking about the case of yesterday. It was a lower limb weakness.
Yeah, it
Unless the
was
patient-
proximal. The difference was proximal myopathy. Here, the
Okay.
patient is, and it was, I think, for the long term. Today, we have a case with acute presentation. So,
Mm.
Guillain-Barré,
Double weakness.
matching our case today. Yesterday, it was as a chronic with waddling gait. So, you can put the
The
proximal
gate is
myopathy.
a difference, yes?
Yeah, exactly. The
Unless I
difference.
see the gate, I cannot differentiate.
Exactly. Here, the patient will not be able to walk. the weakness will be, I think, dense weakness, and he will not be able even to stand or to walk.
Even if chronic, I have seen some chronic patient with Guillain-Barré, they use the sticks. I more than
Yeah,
6
maybe
months.
after treatment and rehabilitation, physiotherapy. But as acute, I think the weakness will be significant, and the patient will not be able even to raise his legs up, against gravity.
Yeah. But regarding the exam, they will bring an acute case or
They
just
will
bring
bring
a
as
history.
history
Okay.
taking, as history
Okay.
taking. Okay.
Thank you.
Okay, most welcome, Dr. Aya. Okay, Dr. Ala, let's start. The timer is set. Here you go.
Okay, hello, I'm Dr. Mitwali. I'm the medical doctor in the clinic today. Let me confirm you are Mr. Ali, 35 years old.
Yes, doctor.
So, Mr. Ali, we are here today to discuss about your condition and to examine you. Is that all right?
Yeah, okay, doctor.
Okay, it came to my knowledge that you have been complaining of high body temperature and the tummy pain. Is that okay? Is that right?
Yes, exactly, doctor.
So, can you tell me more about it?
Yes, doctor. Actually, doctor, I have tummy pain. It started for me before 3 days ago. And also I
Okay,
have high body temperature.
and high body temperature started at the same time?
Yes, doctor.
Okay. So regarding this tummy pain, where exactly this pain?
Yes, doctor. Actually, yes. In the lion area.
Okay. And this
Your
is the first
patient.
time to have such a pain?
Yes, doctor.
Uh, can you grade the pain from 1 to 10, where the 1 is the minimum and 10 is the maximum?
Yes, sometimes 4 to 5, and sometimes 6 to 7 even.
You have pain now?
Yes, doctor.
Do you need any painkillers?
Yes, please. Thank you.
Okay, I will tell them to give you painkillers. Okay. Do you feel this pain is moving to any parts of your body, like to down to the groin?
Yeah, doctor. Yes.
Okay. Uh, do you have any problem in your water work, like increase amount or decrease amount?
Yes, doctor. Actually, since long time, doctor, I think my water work become more increasing frequency and in the amount.
Since when?
Before months, doctor, I didn't sure it regarding where.
Do you feel more stressed?
Yes, sometimes, doctor.
Okay. Do you have any painful micturition?
No,
Did you notice any change in the color of your urine
no, doctor.
or water work?
No,
Okay. Do you have any tummy distension?
no, doctor.
Do you feel like feeling sick or getting sick?
Yes, doctor. Sometimes this tummy pain.
Okay. Any throwing up?
No, just I feel sick.
Okay. And this high body temperature, do you check your body temperature? Do you know the readings?
Yes, I think 38, doctor. 0.7.
Is it there all the time or coming on and off?
All the time. Just subside when uh, yes, I take some painkiller.
Okay. Did you notice it's like more in the morning or more in the night?
I think not related to anything.
Do you have any change in your bowel motion, like loose motion?
No, doctor.
Do you have
I have
hard
hard
motion
motion, doctor. Yes, I have hard motion, doctor.
since when it started?
Yes, just before long time also, yeah, doctor. It come and goes for me, not as constant.
Okay. Did you notice any change in your eye white, like becoming yellow?
No, doctor.
Okay. Did you notice any stool in your back passage? Sorry, any blood in your back passage?
No, no, doctor.
Okay. Did you notice any change in your body weight?
No, doctor.
Any lumps or bumps in your body?
I didn't sure, doctor.
Okay. Did you notice
Doctor, regarding the weight, I think
lump?
yes, I'm lost like 2 to 3 kilo.
This over how much? Over how much duration?
Yes, more than 6 months.
Okay. What about your appetite?
My appetite's okay.
And, did you notice any lump in front of your neck
I
or
didn't
swelling in
sure
front of your
regarding
neck?
it. I didn't sure, doctor.
Okay. Do you have any skin rash?
No,
Do you have any joint pain?
no,
Do you have any body pain or pain in touching your muscles?
no.
Okay. Do you have any heart racing
Yes, doctor.
since when it started?
Yes, sometimes, doctor, it come for me.
Do you feel during this heart racing the beating is regular like the clock or it's like chaotic?
Yes, I think regular, doctor.
Okay. Do you have any shortness of breath?
No,
Any cough?
no.
Okay. Do you have any shakiness of your hand?
Yes, sometimes, doctor.
Okay. Do you have any headache?
No,
Do you have any weakness in any part of your body?
no,
Did you notice any change in your speech, like altered speech?
no, doctor.
Do you feel any pins or needles in any part of your body?
No.
Okay. Uh, do you have any sorry, do you have any history of medical condition or long-standing disease I should be aware?
No, doctor.
Okay. Do you have any family history of gland disease or cancer or any disease of note?
Yes, doctor. Actually, my brother, yes, he has cancer. I think in the gland in front of his neck.
Okay. Do you have any history of blood clot?
No,
Okay. Are you taking any medications?
just a painkiller for this high blood pressure.
Okay. What do you do for living?
Yes, a doctor, teacher.
How much your symptoms affect your job?
Yes, actually, since this tummy pain and high blood pressure status for me, I'm not able to go to my work.
Yeah, I'm sorry for this, Mr. Ali. I hope I can help you regarding this issue.
Mm-hmm.
Okay, Mr. Ali, do you smoke?
Yes, doctor.
Do you drink? Sorry, how many cigarettes?
Yes,
For how long?
5 to 10 since 5 years.
Okay, Mr. Ali, I advise you to stop smoking because smoking is not good for your health and also is not good for your condition. If you need help regarding this, we can assist you by referring you to the smoking cessation clinic if you don't mind.
Okay.
Sorry, Mr. Ali, do you have any problem in your vision?
No, doctor.
Do you feel like when you are walking, bumping in objects or you cannot see your sides?
No, doctor, no.
Okay, Mr. Ali. Mr. Ali, okay. Can I examine you?
Yes, you can, please.
Okay. So I need to check the observation chart to check for the vital, the blood pressure, the heart rate, and temperature. Okay. Blood pressure is okay. Hello?
Yes, we can
Hello?
hear you, Dr. Ala. Waiting for Dr. Sarah. I pause the timer. Maybe she received the call, so we'll wait for her just a while. Dr. Sarah, we cannot hear you if you are talking.
Yes, hello?
Yes?
Hello?
Continue, please.
I'm
Yes.
sorry, because now I have some connection problem. Yes, you can continue.
Okay. Yeah, I need to check the observation chart for the blood pressure, the heart rate, and the temperature.
Mm-hmm. The blood pressure 145/90, pulse rate 100, temperature 38.7.
Okay, I will check the hand for any clapping. I need to
clubbing.
check also. I need to check the hand also for tremors. Okay.
Okay. Not yet.
Then
That's fine. Yeah, that's fine. Tremor.
yeah, okay. Then I will check for proximal myopathy.
Negative.
Okay. Then I will check the eye for pallor or jaundice.
Okay. Negative.
Then I will check the visual field, okay, by moving finger or pen head. Okay, any visual field defect.
Yeah, no need, doctor.
Okay. Then I will do a thyroid examination. I will
Okay.
I will give him water to sip to I will give him glass of water to drink. Okay, I will check for thyroid swelling.
Okay, there is swelling. Yes, there
Okay,
is
I
the
will check.
swelling.
Yeah, I will check if it is soft swelling or it's like nodular swelling.
Yes, fair.
There is painful.
Not painful.
Okay, I will put the stethoscope to hear for any bruit.
No bruit.
Okay, then I will do lymph node examination. Okay, I will check the anterior and posterior auricular lymph node, anterior axillary, posterior axillary lymph node, superior clavicular lymph node,
Okay.
and also the axillary lymph node. Okay, any lymphadenopathy?
No, doctor.
Okay, I will check the heart. Okay, I will listen to the heart for any abnormal heart sounds like S3 gallop or any murmur.
Negative.
Okay, then I will do abdominal examination. Okay, can you tell me? You told me the pain exactly in the right side.
Yes, exactly.
Okay, if you feel any pain or discomfort, just let me know.
Okay.
Okay, then I will check superficial for superficial palpation for tenderness or palpable masses. Okay,
Yes,
then
there is
deep.
tenderness.
Okay, then
There is
I
tenderness
will.
in costophrenic angle.
Okay, then I will do ballotment. Okay, to check for enlarged kidney or palpable kidney.
No. Negative.
Okay. Do you have any? You told me you don't have any pins or needles in your hands or your leg.
2 minutes left.
Yes, doctor. No.
Okay. So, Mr. Ali, can I know what's your concern?
Yes, doctor. What I have, doctor? I'm afraid I have
This-
cancer like my brother, doctor. Please tell me, doctor.
I appreciate your concern, Mr. Ali.
Mhm.
Actually, Mr. Ali, the cancer is a possibility. Okay, we have to do some blood test and some imaging also.
Mhm.
But the cause of your high body temperature and your tummy pain,
Mhm.
we are suspecting that you have bug infection in your water work. This bug infection may caused by increase or X stones in your water work
Mhm.
with underlying problem uh, which causing growth in a gland in front of your neck,
Mhm.
increasing excess hormone. This excess hormone causes precipitation of stones or gravels in in your water work, and these stones may cause the bug infection. Okay, so
Okay.
what we are going to do? Okay, we will run some blood tests. We will run imaging. Because we are suspecting you have a condition called multiple endocrine neoplasia. Excuse me for the medical term. It's a condition caused by multiple growth, including growth in gland in front of your neck and also in the gland on top of your kidney. Okay. This condition is running in family, okay, and may be related also to cancer in your brother. Sorry for this bad news today. We will run the blood test and the imaging, then we'll come back to you. Any other concern?
Okay, doctor. Okay.
Okay, time is up. Well done. Examiner question, please.
Yes, please, could you present your case for me?
So today I examined Mr. Ali. He's 35 years old. He's complaining of abdominal pain in the right loin area, relating to the right groin, also with fever. And he has also complaining from polyuria, and he has constipation and also loss of weight over the past 6 months. He has also complaining of recurrent tachycardia and tremors, and he has family history in his first degree relative with thyroid cancer. So my first differential regarding this finding may be mostly multiple endocrine neoplasia type 2A.
Okay.
Yes, in view of these symptoms.
Okay.
Mostly, and he presented with also urinary tract infection on top of renal kidney stones or because of the hypercalcemia.
You mean that your patient he has UTI?
Mostly in view of the fever and this tummy pain, he has urinary tract infection. On top of the hypercalcemia that he has, on top of kidney stones.
Okay, any other differential for this abdominal pain and fever for your patient?
Actually, in view of this
Or
multiple
this abdominal pain just?
other causes of abdominal pain with fever, this condition is acute, so we can consider acute cholecystitis. Okay, but the character of the pain and radiation is not going with the cholecystitis. Okay, we can consider also acute appendicitis. Okay, but yeah, the most probable here is
Okay. What is
UTI.
your workup, doctor? What is your workup for your patient?
We will do basic blood test. We'll do CBC. We'll do kidney function test. We will do serum electrolyte. Especially, we'll do calcium. We will do parathyroid hormone for the hyperparathyroidism. Then we will do TSH, free T3, free T4. we will
What is the
do
workup of hyperparathyroidism?
we will do serum calcium and serum PTH, parathyroid hormone.
Yes.
Okay. We will do also serum and urine retinephrines for the pheochromocytoma.
Mm-hmm.
And also we can do thyroid imaging, thyroid ultrasound, and also remember centigram. And also for the gene, this red oncogene for the gene mutation. For the urine, we will do urine analysis and also urine
What is your
culture.
treatment, doctor, for this patient?
This condition,
Treatment?
patient education and counseling about his condition. Okay, this condition needs a multidisciplinary team from the endocrinology, endocrinology and mostly endocrinology. Okay. Yes, endocrinology and also the oncology team and also the surgical team. Okay, this patient may need to do thyroidectomy. Okay, if it's proven to have medullary thyroid carcinoma.
Okay.
For the pheochromocytoma, he may need to take alpha blocker like phenoxypentamine. Then we can add the beta blocker, then also surgical excision. And also for the parathyroid, I think also surgical treatment. And also genetic counseling also. Also genetic counseling.
Okay. Thank you, doctor.
Okay, I have question for Dr. Ala. You said beta blocker for pheochromocytoma, right?
No, alpha blocker first,
Okay.
phenoxybenzamine. Yeah, then we will advance beta blocker later.
Beta blocker, yes.
Yes, okay, you correct the answer now. The other question, what are the markers? You said it? Okay, sorry. What are the markers for thyroid medullary carcinoma?
I remember the calcitonin.
Yeah, perfect.
Yes.
Perfect, Dr. Ala, mashallah. Well done. Dr. Sarah will comment, then I will come.
Yes, you did very well. Yes, apart from few comments. Yes, regarding the waterwork, you didn't ask regarding the granules and other symptom of hypercalcemia in these patients, like the mood. Okay, also it can affect the mood. Apart from that, in the history, yes, you also you didn't ask regarding the symptom of dehydration, because your patient now dehydrated because he has this polyuria. Okay, and also in the examinations we need to check it also for sign of dehydration, and also the morphonoid body habits also we need to check for it, because it could be also main type 2B. Okay. I think you cover everything. Your concern, you did yes, address the concern well. Regarding the infections, not UTI, just in this patient pyelonephritis, okay? Because he has tenderness in the costophrenic angle, lion pain, fever, and yes, the cause of this pyelonephritis is due to stone. Okay? So regarding the differential of abdominal pain in these patients, pyelonephritis first one and renal stone second one. Okay, this patient we need to admit, we need to rehydrate fluids, correct the calcium. This is most important things in this patient. Okay.
Yeah. This admission, yes.
Yes.
Yeah, good point. Yeah, because even the
Otherwise,
hypercalcemia.
Yes, because of hypercalcemia.
Yes, also I will add
Yes.
for the tummy pain or abdominal pain differential, hypercalcemia itself. can cause also tummy pain or abdominal pain.
Yes, exactly.
Diffuse, yeah, but with the constipation, along with the
Yes,
constipation.
yes.
Okay, so my comment, Dr. Ala, well done. Really, very well done. Both of you today, you did perfect. I will add comment for both of you in the concern. Whenever the
Mm.
concern is related to one point, answer it shortly. Don't in advance answering the next concern. Okay. So what I have, doctor, you have a condition called and explain the condition. What you will do for me, doctor? Now you will answer what you will do for you, or we will do for you. Don't be
Mm-hmm.
volunteer to tell him we will admit you, we will run investigation. Why? Because he might give you another concern, and you might not answering the next concern, which the time will be, for example, time is up, and you didn't answer the third concern for him or the second concern. He might have another concern different than what you will do for me. Okay, answer the concern according to the question. What I have, tell him. What you will do, I will do. What the treatment, we will do, or we will refer you. But don't be volunteer to say we will run the investigation. We will do the management plan. We will go for the group of specialists. I want him to ask you the 3 or 4 concerns. Some surrogate will ask you many concerns. If you start to talk about the condition and how to run investigation and how to do with the admission, how to manage him, maybe the time will finish without addressing his concern. And there is 4 marks for the concern. Be sure if you do that, so they will minus you. Okay? Don't be volunteer again. The same advice. Don't be volunteer to answer advanced or in advanced the next concern. Answer according to the concern only. Otherwise, both of you today perfect. The relevant system analysis, the complaint, the constitutional, the past medical history, the systemic review questions. This patient was having headache, Dr. Sarah. Supposed to have headache, right?
No. Yes,
For
because
the
of pheochromocytoma,
yeah,
episodic headache. Yeah,
episodic headache. So
that's not. Yeah,
yeah,
yeah.
yeah, he
I
should
didn't
ask
mention
about.
it because.
Anyway, I think he asked about headache.
Yes, ask. He
Yeah,
asked.
and you can ask also about feeling thirsty and how to compensate the polyuria. It's an
Mm.
important question. The
Yes, yes,
stones
it's
and
important
gravel.
question.
Yeah, the stones and
Yes,
gravels
exactly.
is very important. Why? Because this is the presentation. Why he's having fever. I like the comment from Dr. Rehab. She said even the fever as an anxiety or hyper excitability from the adrenergic sympathetic activity could lead to fever. Yes, there is possibility. However, you have to rule out infection if he has any signs of infection. Otherwise, the answer was good. The investigation, the approach, multidisciplinary, non-pharmacological, everything today was perfect, really. The tumor markers, yes, the calcitonin for the recurrence. And whenever you diagnose the patient with MIN2A, you should do surgery, Dr. Ala, or you should screen, or what you will do. How the chance this
For the
patient will
patient
be
or
a cancer? Okay, for the patient himself, will you do the surgery?
yeah, surgery,
Yes, it's
thyroidectomy.
prophylactic. Yeah, prophylactic thyroidectomy, exactly. He should remove the thyroid gland. And for the screening, you didn't mention the screening. Whenever you have patient with inherited condition or familial condition or genetic condition, you have to mention the family screening. This patient, if he think about having baby or having kid, he will transfer the gene to his kids. In how much percent, Dr. Ala?
50%.
Yeah. So he should have planned pregnancy with her with his wife. Before that, he should do the genetic counseling. So you can
As
add
you mentioned, we talked too much in the concern. That's why we couldn't address everything.
it,
But I mentioned the genetic counseling in the management plan.
one of the concern he might tell you, doctor, will my kids have the disease? if you didn't give him a chance to ask, because sometimes the patient will not care about the investigation. He care about what you will do for him, and what about my babies? They have any chance to have the disease? Why? Because he will give you the time for investigation and management plan with the examiner. He doesn't care about the management plan now, or he doesn't care about the investigation now. He want to know what he has and any possibility, for example, for the future of his kids or in his job. One concern was what my uncle will do in his job. Imagine. So this is the concern. It was the concern for the patient. Doctor, what my uncle will do in his job? And the answer was, we will give him sick leave. He didn't ask about what he has, what investigation I should do or she do, or what the management plan possibly he will be underwent. So be answering the concern according to the concern only. This is my advice as experience in cases. Sometimes, believe me, they will minus the candidate in the concern marks, and I heard many stories. The candidate failed the exam for the concern skill. Why? Because he didn't answer the concern or he didn't ask the concern. That's why I'm giving advice about the concern to answer it shortly and according to the concern itself. Is it clear now for all? Okay, Dr. Ala, I didn't mean you only. I mean all, really. Even Dr. Sarah, she's also volunteered to answer the
Yeah, it's a
concern.
good,
Yes.
yeah, it's a good advice. Yeah.
Yeah, always search for the negative feedback. Because the positive feedback, okay, you know it, or someone will tell you. But the negative feedback, it's always for your defect, and you have to improve it. Okay? That's why whenever you hear the partner saying to you, I have few comments, be happy. Don't be upset. Why? Because she will tell you what you are missing. But if I tell you everything is okay, you did perfect, nothing missed, so what you will do in the exam, you don't know, and maybe you will miss a lot of things because no one corrected you. So always search and look for the negative comment, how to improve it. I'm telling you about the experience in basis. Try to follow as much as you can. Hopefully, inshallah, you will pass the exam. Okay, you have any question, Dr. Ala? Or Dr. Sarah?
Thank you for this.
Okay, Master. Any question or comment from others?
Just I'll add one point, Dr. Bassem. In
Yes,
case of
Dr.
men, they can ask what you need to follow up this patient, because all the adenoma of parathyroid and also the fake chromocytoma is recurrent. And if the patient not having prophylactic thyroidectomy for any reason, maybe he will not prefer to do that. So he will say to you what you need to follow up this patient. 6 monthly, 24-hour catecholamine in the urine, and you should make do the both thyroid tumor markers, calcitonin and carcinoembryonic antigen, and the calcium level. This will be screening for this patient. If he remain for some years is good, so you can shift this follow up every 1 year according. But the best for this patient to do prophylactic thyroidectomy, because the medullary thyroid cancer can having also no marker, and also it is present directly by metastasis. No any thyroid swelling and any symptoms. You can having metastatized symptoms before even you will discover any masses.
Yes, perfect. Thank you, Dr. Aisha. This is as a follow-up and screening for the future. I think also blood metanephrine would be added, not only urinary. Can be done as well.
Maybe,
Is it?
yes.
Yes.
But just it is this as a screening they already
Urinary only. Okay.
mention, yes.
Okay. The other thing I want to add and stress on, with the same comment to Dr. Aisha, it's asymptomatic thyroid cancer. So he will never have symptoms, only swelling or goiter. So whenever he has the swelling, he should have the thyroidectomy as prophylactic. It came in the communication as well for the babies born with the father of men 2A. Whenever he has the gene or diagnosed with the gene, the son will have the surgery, thyroidectomy, prophylactic thyroidectomy. Okay, there is always high possibility, 100% possibility to be a cancer in the future. So he should do the prophylactic thyroidectomy. I think there is percentage also for the furochromocytoma, 50%, and parathyroid, 10%. Okay. He might ask you, or it might come as a communication scenario. Any questions or doubt, suggestion? Okay, some comment, Dr. Baser. I think it's better to finish the clinical judgment here by explaining the planning of management. Of course, if he doesn't have concern or specific point to explain, you can tell him about the management plan. I'm talking about a specific concern. He might give you concern related to the condition he will care about. Either fertility. Some patient will ask you about fertility. He doesn't care about the investigation, but he will ask you, doctor, is there any possibility for to be fertile or to have baby? And I mean in another condition, not in this scenario, for impotence, for example. So always answer the concern that the patient care about, or he will ask you about. If he kept quiet, okay, answer and say whatever you want to say. You ask him any concern. He said, no, doctor, I don't have. Now you can tell him, now we will admit you, you run some investigation, we will do blood tests, whatever you want to do. But initially, let him give you 2 at least or 3 concern that he will care about it. Okay, can we put pheochromocytoma as differential of tummy pain and fever? Yes, I agree. So the differential for this scenario could be either men or isolated pheochromocytoma or hyperparathyroidism. Okay, as well as the men 2A. What about hematuria and adult polycystic kidney disease? I don't think it can be a case or a differential because you have another manifestation. This is not
If,
the presentation, the
if
hematuria. I mean.
pheochromocytoma works with come with pain, so it will be cancer, like metastasized or invading the capsules.
Yeah, you mean the pheochromocytoma itself. Okay.
Yes, because if it is just adenoma, it will not cause any pressure symptoms, any pain.
Yes. Okay, asking about hematuria again, Dr. Rehab. I don't think it's differential. Why? Because the patient is presented with fever and tummy pain. No hematuria or no urinary symptoms. Whenever you have hematuria, okay, you can put adult polycystic kidney with the renal colic, for example, or renal stone. Otherwise, you cannot say it as a differential in this scenario. Fever as a part of manifestation, yes, sympathetic. We mentioned that, Dr. Rehab, thank you. Anyone with other concern or suggestion or doubt or any question?
Yeah, Dr. Basim. So this patient in the history, it was positive, like passing gravels in urine.
Yeah, I think so. Dr. Sarah
Positive in the
also will
history.
say. Yeah, I think stone, not only gravels. Dr. Sarah, you're still with us?
Yes, yes, just I have.
Is it stone or only gravels?
It's
What?
positive in the history.
The
Yeah,
stone,
in the history gravels, yeah, there is gravels, but
gravels? Okay.
he didn't ask regarding this, yeah.
That's a good thing.
So put it in your screening whenever you have urinary symptom. Frequency is increased, difficulty of micturition, the amount, the color, the blood, and gravels or stone. Okay. Always ask simple question earlier, okay, or initially. For example, you have any change of the color of your urine. If there is any positive data, one single positive data, you have to screen the whole system in the genitourinary, I mean. If you have increased amount, so you can ask about the color, the amount, frequency, difficulty, burning, blood, gravels, even you can say pass or discharge, or a change of the color. This is not only for genitourinary system. Whenever you have system affected, you can ask about the relevant system. For the previous scenario, for example, or let's say about the GI, if you have patient with tummy pain, so I will ask about all GI questions, starting from the mouth sores, difficult to swallowing, tummy pain, tummy distension, a change of the bowel habit, any blood in your back passage. Okay, these are the question or detailed question about system. But if you don't have positive, for example, GI symptoms, no need to ask all these questions. This is the way how to analyze affected relevant system. Okay. By the way, fever as a constitutional complaint, you will ask the whole constitutional symptoms as a package initially also. Fever, night sweats, lumps or bumps, change of the appetite, change of the weight. In this scenario, of course, it will be positive because there is a cancer. Even the phacocytoma might lead to loss of weight. Any question? Any suggestion? Any added point? Okay. Thank you, Dr. Rehab. Thank you, Dr. Ala, Dr. Sarah. Everyone attends sharing with us. Dr.
Thank you.
Rabia. Thank you. Thank you, Dr. Raga, Dr. Aisha.
Thank
We'll
you,
see you
Dr.
tomorrow.
Bassem.
Most welcome, most welcome. See you tomorrow, inshallah, with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.